Welcome to First Aid Academy. Today, we're going to talk about some of the most critical first aid procedures, specifically for head, neck, and back injuries. These injuries can be life-threatening, and immediate care can make a significant difference. Let's dive in. Head injuries can range from mild concussions to severe brain trauma. If someone has sustained a head injury, the first thing to do is to ensure their safety and call for emergency help. Here's what you should do. Check for responsiveness. Gently tap and ask if they are okay. If they respond, keep them still and check for symptoms like confusion, headache, or dizziness. Control any bleeding. If there's bleeding, use a clean cloth or bandage to apply gentle pressure. Avoid pressing too hard, especially if you suspect a skull fracture. Watch for signs of concussion. These include nausea, vomiting, blurred vision, and loss of balance. Keep the person awake and monitor their condition until help arrives. Avoid moving the person. If the person is unconscious or seems disoriented, avoid moving them as it may worsen any potential spinal injuries. Neck injuries are incredibly delicate and can lead to serious complications if not handled correctly. Here's how to provide first aid. Call emergency services immediately. Neck injuries should always be treated as severe until proven otherwise. Stabilize the head and neck. Gently support the head and neck without moving them. If possible, use your hands to keep the head aligned with the spine. Do not remove helmets or headgear. If the injured person is wearing a helmet, do not remove it. It might be keeping the spine in alignment. Monitor breathing and circulation. If the person stops breathing, be prepared to start CPR, but only if you are trained and there is no other option. Back injuries can result from falls, sports accidents, or heavy lifting. Here's what you should do. Do not move the person. If someone has a suspected back injury, moving them could lead to paralysis or further injury. Keep them as still as possible. Check for signs of paralysis. Ask the person to move their fingers and toes without moving their back. If they cannot, it could indicate a spinal injury. Apply a cervical collar. If trained and one is available, carefully apply a cervical collar to prevent further injury to the spine. Keep the person warm and comfortable. While waiting for emergency services, cover the person with a blanket to prevent shock. There are some common mistakes people make when providing first aid for these types of injuries. Never attempt to move someone with a suspected neck or back injury unless there is an immediate threat, like a fire or falling debris. And never give an unconscious person anything to eat or drink. Understanding first aid for head, neck, and back injuries is crucial for everyone. It's not just about helping others, but also empowering yourself to act confidently during emergencies. So, remember these steps, stay calm, and prioritize safety above all. If you found this information helpful, please subscribe to my YouTube channel, First Aid Academy, for more life-saving tips and tutorials. And don't forget to share this video to spread the knowledge. Together, we can build a safer, more informed community.